Hi, everyone. Welcome to the second Cochrane Priority Setting Methods Group webinar. I'm Mona Nasser. I'm one of the co-conveners and the chair of the Cochrane Priority Setting Methods Group, and we're looking forward to having the second seminar with all of you. Before we start the webinar, I just thought I'd give you some some of the issues about how you can use the platform. You have under the screen you have an option called Q&A that you can put in and put your question in. Everybody can see your question, and we would at the end of the seminar would answer them. We would go through all of the lectures, all of the talks before we go to the question and answer of it. Yep, and the session would be chaired by me and Daniela Oring. So I'm a professor in clinical epidemiology and director of Plymouth Institute of Health and Care Research. Daniela is also one of the associate professors in optometry in the University of Plymouth. So our first speaker is Joseph Millum. He's a senior lecturer in philosophy in Department of Philosophy at St. Andrews and the chair of the International Society of Priorities in Health. So I hand it over to Joseph to deliver the first talk. Joseph?
Thank you, Mona. Actually, Katherine is going to be giving the first talk.
That was my mistake.
No problem.
Let's go. Okay, so I will introduce Katherine to you guys. Katherine is the co-head of the Health Ethics and Governance Unit at the World Health Organization. So, Katherine, hand it to you.
Brilliant. Thanks, Mona, for the introduction. And apologies, Joe and I like to just confuse people by swapping orders around. So I'm going to start and give a sort of brief introduction to this program of work that we've been undertaking for the last 2.5 years, I think now. And then Joe, who's been the lead writer on this work, is then really going to give an in-depth discussion on what's in the guidance. And then we're going to have a great discussion on it, I think. I'm also, when Joe finishes, just going to give a few reflections on the process and the experience, because it's the first time and the first guidance of its type on ethical research priority setting. So it's been quite an interesting endeavor to undertake. So I'm going to share my screen. The context of why we're doing this guidance and where it's situated. So I think first and foremost, it's very important just to remind ourselves at WHO where this fits. So obviously we see health research as a vital tool for improving global health. Very important that this type of work is critical for the strengthening of both health and research systems, but research systems in particular. And we know that there's been a lot of work around ethical priority setting in the context of health, but not so much in the context of doing research. So there's an obvious existing gap in an important area of WHO's work. This guidance also is responding directly to calls for greater equity in health research globally, both direct calls associated with a marked increase in priority setting exercises in the health sphere, in the health and research, particularly in the research sphere over the last 5 to 10 years. And it'll be an interesting conversation, and I think it's relevant to the development of the guidance, why we think that is the case. And I do want to come back to that in the discussion, because I think with the growth of priority setting exercises in research, they're also sometimes being conflated with other types of activities that are going on as we democratize research and greater inclusion of participants in activities associated with research, greater engagement, both community and wider stakeholder engagement. Both important, but it's interesting how that's impacted on the way that priority setting has taken place over the last 5 to 10 years. Also, the other observation going into this guidance is that obviously there are a lot of decisions being taken about what research gets carried out, and they are often opaque. So we really don't understand why they're being made. And actually, What's interesting about the current guidance on priority setting, and we've even got current guidance at WHO on priority setting, that's very much technical guidance aimed at our technical units and also at the regional and country offices. There's a real focus on issues, I'd say, associated with procedural ethics. So they're trying to address on some levels this opaqueness, but only really thinking about process, so inclusion and transparency and those sorts of things. So we really want to address that element in this guidance, but as Jo will really speak, we really want to address the substantive ethical issues that are happening when people make decisions about priority setting. It's important to note, and I'll give a slide later, I'm not going to talk for too long, really focusing on that this is really aimed at the wider community. But WHO itself and a lot of our technical units at the moment are undertaking research priority and agenda setting exercises. And I think this definition of what's included in priority setting is really important. So during the last 2.5 years of putting together this guidance, we've had the privilege and actually it's been really interesting to be involved in some of those priority setting exercises, and particularly working close with the migration health team at WHO, which are really cognizant, I think, of a lot of the ethical issues. And a lot of the other units are currently undertaking priority setting, everything from the evidence to policy area through to pediatrics, as well as climate change colleagues. Climate change and health are all currently involved in priority setting exercises. It's also important, as when Mona introduced me, she said I'm part of the health ethics and governance unit at WHO headquarters, and that unit actually sits in the science division at WHO. And we have like 5 main work areas, everything from planetary health ethics through to clinical global health ethics, but research ethics and the governance of it is a key work package of our unit. And this work fits squarely in it, thinking about the big meta questions in how we govern research and who benefits from that research and who is included in that research is a core part of our remit. So that's really kind of situating the work and why we started it. Realizing there's a gap, this guidance doesn't exist, there's a clear need. We were getting both direct and indirect calls for the production of this guidance. And it really is, I think, a sister guidance to the one that's already out there by WHO, really focusing on the technical issues attached to doing this. The other one I want to say, and I think Jo will probably pick this up in his talk, is that it's really methodological approach agnostic. So we're really not there to say that one particular approach to priority setting is necessarily better than another. As I said, from saying how long we've been doing this, it has been a long process. We established a small and deliberately small expert writing group to help with that. And as Jo has pointed, you will hear from Jo, he's been the lead writer on that, but we've benefited greatly from representation across the globe. They have been meeting regularly, almost monthly, I would say, during this entire process. We have had extensive consultations with stakeholder groups, both from going and talking at meetings, so global conferences. We've spoken at the Global Health Bioethics Conference, which is held annually in Oxford. We presented an outline of the work and a draft at the Global World Research Integrity Conference in Athens last year. I followed up then again with the European group of people working on this because, as many of you may know, in the Cape Town statement for research inclusivity, one of the things that they really said is that the research integrity community should be focusing on issues of research prioritization. So we sort of, from the outset, thought of them as a key stakeholder group to what they really were thinking about in terms of priority setting, but also in terms of implementation. We've also consulted with lots of different types of groups. So we've consulted with funding groups from the Essence group to the Glopidar group. We've consulted with 3 of the National Institutes of Health in the US, 3 of their sub-institutes on what should go in this guidance. We've spoken with the World Patient Alliance, with regional officers. So we had a separate webinar with the Pan American Health Organization's office. We've spoken with people undertaking priority setting exercises at the national level. And as I said, we've consulted and spoken with colleagues at WHO in different areas, and with researchers, and also had a satellite event at the Global Forum on Bioethics and Research, which was held at the November 2023, which was particularly focused on the ethics of research priority setting. We published also the draft guidance online for public consultation, knowing that even when you consult widely, having over 12, 14 webinars, you're still not going to reach a broad audience. And I think as we think to revise this, that's something we need to think about: who gets a seat at the table and how can we make the public consultation process more inclusive. It has gone out also in line with WHO processes for developing guidance for external and internal review, and we are in the very final stages. It's now going through the publication and editing process, and I don't know those who are familiar with WHO processes, this takes time, but we are hoping to publish towards the end of April this year. Just quickly, because I think it's important how we have defined in the guidance priority setting, in particular research priority setting. So we're giving it a broad definition. We think it occurs whenever decisions or recommendations are made about what research will be conducted. It is labeled often under very different titles, but we think strategic planning and agenda setting are included in our definition of priority setting, and we really are aiming the guidance at people undertaking those specific activities. It can be explicit, obviously conducting, anyone saying they're conducting a priority setting exercise, or anyone saying they're conducting an agenda setting exercise, or it can be implicit. So clearly the creation of new grants programs, how you get to that decision to make a new grant program actually entails a priority setting exercise that we want to capture in this guidance. Going on to the actual aims of the guidance, and it would be interesting to have a discussion whether what we started with is where we've ended up with in terms of the aims of the guidance after this over 2 years process of engagement and development. But really, I think number 1 is to encourage explicit, systematic and principled priority setting. I think we really want people to understand it is technical, but it's also an ethical decision-making process. And no matter who you are, if you are the head of a funding organization, or you are the head of a technical unit at WHO undertaking a priority setting exercise, or you are a researcher, just to think what's within your remit and your capability and to make a sort of an explicit decision. The guidance aims to describe the ethical considerations relating to the allocation of scarce resources for health research. And I think this is particularly topical because I think those resources look like they're even more scarce in today's world. So it really does need thorough technical and ethical considerations as to how we allocate those resources. This is not a panacea, this guidance. I think that's also really important to point out. We don't expect it to be that. We're really actually having a behavior. Part of this is behavior shift, really getting people to take these ethical considerations and principles into consideration. And finally, we really do want to guide key decision makers in incorporating those ethical considerations into their work. As I said at the beginning, we're aiming for a broad audience, which is really tricky, I think, when you're pitching and actually developing this type of guidance, how to frame it and situate it that you're making both a global, regional, national level relevant guidance. So again, anyone who makes decisions that affect what research is conducted, and that it is a lot of different people, funders, policymakers, including national and transnational bodies, research institutions, and researchers and research teams, community organizations, professional associations, and advocacy groups are really part of our key target audience. And I'm going to stop there and hand over to Joe, but hopefully when Joe finishes, I can just come back and after he's given you the context of this and the details of what's in that draft guidance, I can just share a few reflections on the process and where we see this taking us. And I'll stop there and thank you. And hand back to our chairs.
Thank you, Katherine. That was really interesting to listen to. And I now have the pleasure to introduce Joseph, who is a senior lecturer in philosophy in the Department of Philosophy of the St. Andrews University. And he's also the chair of the International Society of Priorities in Health. Welcome.
Thanks very much, Daniela. And thank you to Mona and the team who have organized this, and to everyone who's attending. So I'm going to follow on from what Katherine has been talking about and talk a little bit about the content of the guidance. I won't be going through it in its entirety because there's quite a lot there, but I'm going to try to give an overview of the ethical principles and how we think the ethical principles should apply to priority setting exercises. I'm going to start by taking a step back and thinking about why ethics is relevant to research priority setting in the first place. Priority setting, as Katherine explained, is about making decisions regarding what health research is going to be conducted, or at least making recommendations about what health research should be conducted. But those decisions are decisions that ultimately affect which populations receive important benefits. If a funder decides that it's going to put more money into, say, cancer research and less money into TB research, well, it's likely that patients with cancer are going to benefit rather than patients with TB. We can't predict exactly what benefits will derive from what research, but we can say enough to know that if we shift funding in one direction or another, we're making a decision about which population receive really important benefits. But the question then that priority setting is answering, which is a question about who is going to benefit, that question is an ethical question, right? In fact, it's a question about justice. As a result, we think, first, there's an ethical obligation to set priorities explicitly in a principled way. So if you're making a decision about allocating a scarce resource where that resource is going to benefit some groups rather than others, then you're answering an ethical question, and you therefore have an obligation to actually do priority setting. We also think that this means that priority setting is always going to involve value judgments. And the fact that you're making a decision about the allocation of benefits means that whether you take yourself to be engaged in ethical analysis or not, you're in fact making value judgments. So ethics is not something that is added on to priority setting. So you work out how your exercise is going to go, and then you make sure you do it in an ethical way. It actually runs through the design of any priority setting exercise. As a consequence, the key message of the guidance is that decisions about what research to conduct, promote, or support should be made explicitly in a systematic way and guided by ethical principles. So that is in itself an ethical judgment that priority setting should be done, and it should be done in a systematic way, guided by ethical principles. The guidance lays out 4 very broad ethical principles that should be used in any research priority setting process. 3 of which are substantive, 1 of which is procedural. And what I'm going to do is I'm going to go through those principles relatively quickly, and I'll then say something about conceptually how those principles relate to making decisions about what research should be prioritized. The 4 principles are to optimize social value, to respect special obligations, to assess risks, and to follow fair procedures. So I'm going to go through these one by one, explain what they mean, and try to motivate them. Start with the principle of optimizing social value. Now, social value is a term of art, and it refers to the importance of the knowledge that is generated by research. Now, knowledge that's generated by health research is important, ultimately, because it can benefit human health and well-being, right? Where we are dealing with health research that is very close to policy or practice, this may be immediately apparent, right? So, for example, you do a comparative effectiveness study looking at 2 different treatments for a particular condition. It's very clear why that knowledge is going to be beneficial. But even very basic biomedical research, ultimately, what's important about it is that the knowledge we gain has some prospect in the end of leading to benefits to human health and well-being. So that's what the social value of health research is. Now, when we're thinking about how benefits to human health and well-being matter, we care about both the amount of those benefits and how they're distributed. So research that is more beneficial is, all things equal, better, but also research that leads to reduction in inequity is better. So, for example, research whose benefits are expected to go to those who are most disadvantaged. Consequently, we define the social value of a research project more specifically as a function of the likelihood that a research project will generate beneficial knowledge, the magnitude of the benefits if they were to result, and the impact on equity. So there are 3 components here going into what social value is. Now, when we're engaged in research priority setting, what we're doing is ultimately choosing among or ranking different research options. So we might be, for example, engaged in an exercise where we look at different possible disease areas that could be funded and prioritize among those. Or much more specifically, we might be generating a list of uncertainties or potential research questions within some area, and then prioritizing among those research questions which to answer. Right? So you might be asking, what are the problems that are most important to answer regarding the treatment of patients with diabetes? You then, in your research priority setting exercise, be generating a list of those potential questions and then ranking them. The claim that we should optimize social value is a claim that we should compare these research options on the basis of their social value. And in the case where we're actually thinking about the allocation of scarce resources, so for example, if you're thinking about the allocation of funding, they should also be compared on the basis of cost. And so the goal of the priority setting exercise is to generate a portfolio of research options that is optimal given the costs in terms of the social value of that research. Okay, so that's optimized social value. Second principle, respect special obligations. Some priority setters have special obligations to particular populations. So, for example, national governments have obligations, most people think, to their national populations. That is, they should give some priority to benefits that go to their national populations. The guidance also argues that more wealthy countries, so high-income country governments, have global obligations as well. That is, the obligations don't just stop at national borders. Another example, non-profits have obligations to populations that are specified in their mission statements. So if you are a cancer research charity, you're fundraising on the grounds that you are going to support cancer research. that means you have special obligations to allocate your funds so that they actually are supporting cancer research. Research groups have obligations to populations with which they work. If you are already embedded in a particular community and you're planning to do research there, you have an obligation to be doing research that is expected to be beneficial to that population. So the second principle is the principle that those special obligations should be respected. The priorities that are chosen should be consistent with those obligations. Principle 3 is to assess risks. Some research projects have predictable risks to third parties who are unlikely themselves to benefit from the research. So we're not thinking here of risks in the sense of potential side effects for patients who might also be benefiting from new research products. That all goes into social value. We're thinking here about third parties who are not going to benefit from the research themselves. And this third principle says that those risks should be assessed, and projects with such risks should either be justified, it's socially valuable enough that the risk is acceptable, or they should be excluded. This is imposing too much risk on third parties. It's therefore something that shouldn't be carried out. And we can think about these third-party risks in different categories. One obvious category is category of human research participants, right? So in thinking about the ethics of research with humans, what research ethics committees are asked to do is think about the social value of the research, think about the risks that are imposed on humans, and decide, are those risks worth it, given the social value of the research? And if they're not, then the research is presumed to be unethical. Now, we think that, in general, assessing research ethics in the sense of the ethics of research with human participants, that's not something that should be done at the priority setting stage. We think there's a perfectly good system set up for reviewing such studies later. So it's going to be rarely the case that while setting research priorities, you can say, this question definitely cannot be answered in an ethical way. But it's at least possible, and if so, it could be excluded there. It is sometimes going to be the case that decisions can be made while priority setting about the use of non-human animal subjects. That is, there may be entire lines of research that include imposing considerable suffering on and killing non-human animals, while comparable lines of research do not involve animal subjects. So decisions there about whether or not the harms to animal subjects are justified could be made in some cases at the priority setting stage. And then there may be cases where there are predictable harms from the use of research results. So for example, we can assess at the priority setting stage, do we want to invest in research that is potentially dual use research, where it could be used for harmful as well as beneficial actions. Okay, so that's principle 3, assess risks. Fourth principle is to follow fair procedures. An ethical priority setting process will instantiate the 3 previous principles, those 3 substantive principles I just described, through a process that is procedurally fair, meaning that it is accountable, it's transparent, and it's inclusive. And we think that the substantive and the procedural are complementary. That is, we think that a priority setting process that does instantiate these 3 substantive principles will also tend to be one that is accountable, transparent, and inclusive, and vice versa. Importantly, in thinking about the process, we should also be ensuring that the process is one that is proportionate. What this means is that the time and resources that get allocated to a priority setting exercise should be proportionate to what is at stake. As Katherine mentioned, we have a lot of different potential audiences in mind, and some of them will be engaging in the allocation of substantial resources Some of them will not. Some of them will be operating on a long time scale. Some of them will not. A national funder that is making, say, a 5-year plan for a country and what its national priorities should be, there we would expect you would have a priority setting process that was pretty thorough, inclusive of the various groups that are affected and so on. If you were thinking instead about how should priorities be set by, say, a research unit, where the resources it has available for priority setting and indeed for doing research are much more minimal, well, we would not expect such an extensive process to be carried out by a single research unit. So we're thinking throughout and thinking about the processes that instantiate these principles, that they need to be proportionate to what's at stake. I'm going to say a little bit more about the third part of the principle of following fair procedures, which is that they should be inclusive. We recommend thinking about who to include and how on the basis of why a particular group can be included. So we can think about the reasons for inclusion, and that will guide us in identifying the groups and also thinking through carefully how those groups can be appropriately included. There are different reasons for inclusion. One of the most important is epistemic reasons, that is, reasons to do with knowing things. Including members of a group can increase accuracy, can reduce bias. So one reason why you might want to include patients in a priority setting exercise is because you judge that patients are going to have particular insights into what is most important for them. Likewise, one of the reasons why you might want to include scientific researchers in your priority setting exercise is that you expect those researchers to have expertise relevant to deciding which research projects are plausible, which ones are clearly not going to lead to successful projects. Right? So these are reasons why you might include people in your priority setting. There are also pragmatic reasons for including different groups. There's reasons whereby including them may increase the impact of priority setting. So, for example, one of the reasons for including policymakers or including representatives of funders is to get buy-in from those groups in order that they might actually take up the priorities that are generated by a priority setting exercise. And you can see, just thinking about those different reasons, that the way that you include members of different groups might be different depending on whether you're including them for epistemic reasons or pragmatic reasons. And then finally, there may be intrinsic reasons for including members of a particular group. That is, they may have the right to be included. So think here of the claim that members of a community might have to be included in decisions about what research is going to be done within that community. In thinking about who should be included, priority setters should aim for sufficient diversity of participation. And we think of this diversity of participation in terms of both the range of participants and the mass of participants. So a sufficient range of participants should be included from the different categories of research producers, so scientists, for example, research users, so clinicians or policymakers, for example, research beneficiaries, so patients and carers, for example. Now, of course, these examples I'm giving can also fall into different categories, and so patients can also be research producers and research users. The point is that in thinking about whether we have a sufficient range of participants, we should be thinking through which interested parties fall into each of these categories. And then, within those categories, a priority setting exercise should aim to have sufficient mass of participants from each category and across the demographics of that category, meaning there should be sufficient people from each category to represent the diversity within it and to ensure that people are able to speak up and feel empowered in a priority setting exercise. On which note, we can say here a few things about how people should be included, and there's much, much more about this in the guidance itself. The overarching aim in thinking about how people should be included is to include them under conditions of qualitative equality, that is, within the priority setting exercise. As far as possible, people should have equality of power, equal voice, equal say. Participants should all be empowered to raise their voices and also to be heard. And we have a series of specific recommendations on the inclusion of disadvantaged and marginalized groups, that is, how they can best be included in order to, as far as possible, reach this goal of including everyone under conditions of qualitative equality. I've included here one of the graphics, which shows a spectrum of inclusion moving from deep inclusion at shared decision-making through to participants giving information, through to participants being simply informed about priorities. We don't render a verdict in the guidance on which of these is preferable. It's going to depend on the context. It's going to depend on what, who is setting priorities and what they're setting priorities for. But it's important to see that there are different options and there are good reasons for picking one over the other. Now, Mona mentioned last week priority setting exercises going through 3 stages, which we label the preparatory stage, the prioritization stage, and the follow-up stage. I've listed here the steps that we discuss in the guidance for each of the stages. And what we do is we go through each of these steps and talk about how the ethical principles may apply to those steps. I'm not going to do that now. The guidance goes into this in great depth, including through flowcharts and guiding questions to help users think through how should they design their priority setting exercise in the light of these principles, accepting that different priority setting exercises are going to incorporate different of these steps as they decide on a list of research priorities. Rather than going laboriously through that, I wanted to take a couple of minutes to give a sort of conceptual map of the process. That is, explain in designing a particular priority setting exercise, in picking the method or designing the method that a priority setter is going to use, what is it that they're trying to do? That is, how do the ethical principles in the end shape what that process is going to look like? And so this, in a very simplistic 30,000-foot way, is how I think about what the overall process is trying to do. And we'll see whether or not it resonates with you. So start with the universe of all possible research projects. Right? This is all the research that could be carried out. Within that, there is a set of research projects that are actually feasible. That is, that this particular funder or organization could realistically fund, support, carry out, what have you. That's the set of projects among which we're going to be selecting the research options that get prioritized. Now, looking at the feasible research projects that, say, a funder or an international organization could support, well, some of them are going to be inconsistent with the priority setter's special obligations. Right? So you have a cancer research charity. There's some research that it could support that would not constitute cancer research, just going to be excluded on the basis of special obligations. Likewise, in reviewing the different research options, there may be research projects that are excluded because they would involve harms that are unjustified, right? So we apply the principle of assessing risks. We exclude those research projects that would lead to unjustified harms. What we have left is a set of feasible research projects with exceptional risks that don't conflict with special obligations. And they're the ones then that we're prioritizing among during the prioritization stage of the priority setting. So those research projects are going to be ones that would promote social value to different degrees, right? Which means each of the projects that could be included among the set of priorities, each of those needs to be assessed on the basis of social value to come up with a ranking or with a set of top priorities. Given the definition of social value, each project will get assessed on 3 dimensions: the magnitude of benefit, the impact on equity, and the likelihood of success. Right? Those are the 3 components of social value. And so for each possible research project, the goal is to work out what the social value of that research project is along these, using these 3 dimensions. And so, again, just conceptually, the social value of any particular research project will be given by the volume of this cuboid, right? We have basically a 3-dimensional graph. If we do this for all the research projects, then we can rank those possible research projects by their social value, right? So then we have a long list of projects ranked by social value. We can make this more complicated if we're considering the cost of each individual project as well, and that'll also adjust the size of the cuboids. But conceptually, that's what's going on. And then we aim to identify the top research projects in terms of social value, and those will be the set of priorities. Now, that whole process, right, which is going to be the process that is instantiated by going through the stages of priority setting, through all the many steps involved in a priority setting exercise, that whole process should be done in a way that is procedurally fair, that is instantiating this principle of fair procedures. Okay, I'm going to close by just mentioning a key technical challenge, which is the challenge of estimating social value, right? This cuboid is a very optimistic cuboid. I started this presentation by talking about why we thought that this was an ethical problem to begin with. Justice requires we distribute the benefits of research fairly, right? So and social value represents the importance of the benefits. So comparing research options on their social value is something that needs to be done if we're actually going to end up with a set of priorities that is just, that is distributing these benefits fairly. But the technical challenge is, how do we estimate social value? Right? If we could just put values on everything, we could do a simple calculation. We'd have a priority score. We'd multiply together the probability, the magnitude of the benefit, and the equity impact. We'd divide by the cost, and we'd be able to just come up with a ranking. That, of course, is something that, with health research, given how much uncertainty is involved, is incredibly hard to do. So I think that the different ways in which people go about research priority setting can often be thought of as different ways of trying to estimate social value or compare research options on the basis of their social value. Right? So some priority setting exercises use proxy measures, right? So they'll look at burden of disease as a proxy for the magnitude of the benefit from a research study. They'll look at the disadvantage of patient populations as a proxy for equity. They'll look at the scientific merit of a research proposal as a proxy for the likelihood that the research will be successful. So that's one strategy. Another is to use some method for building consensus among experts, right? So the Delphi method, for example, is basically used in order to try to do forecasting when it's not possible to run a calculation of what's going to happen in the future. And that's the reason why it gets adapted so often for research priority setting. Similarly, I think those methods that involve focusing on inclusive decision-making, like the James Lind Alliance method that we heard about last week, or participatory action research, they're also based on a view that we're going to get the most socially valuable research options chosen when the people who are most affected by the research get to be an essential part of the decision-making team. So I don't know which of these is best. It may be that one is best for some situations and another best for others. But I want to close just by emphasizing that in order to actually allocate the benefits of research fairly, we do need to be comparing research options on their social value. And I think it's as yet uncertain what the best way is for comparing projects on social value. So to summarize, the WHO's new guidance on the ethics of health research priority setting is going to be published in April 2025. It argues for an ethical obligation to set priorities explicitly and guided by ethical principles. And it identifies 4 broad ethical principles, which I've described today, and shows how they can be integrated into the design of a priority setting exercise. So thanks very much for listening.
Thank you very much for everyone. Thank you very much, Joseph and Katherine, for the talk. It was really, really interesting. We have one question from Sumans. What does WHO recommend to balance local and global research priorities? Any of you, Joseph, Katherine, if you want to
Joe,
take
do you want to start and then I'll come in?
Sure. I can't speak for WHO, but I can speak for my thoughts on this. First of all, I think it's a really important question. And I think it's going to depend a lot whose perspective we're looking at, right? So from the perspective of, say, a national funder, it may be perfectly reasonable on the basis of the obligations that they have that they should be thinking more about local priorities. And from the perspective of an international organization, it may be perfectly reasonable that they're thinking about global priorities. The challenge is when those two intersect, right? That is, in the case where we have, say, global priorities, say we have global priorities for antimicrobial resistance. And then we're thinking, okay, so where's the research actually going to take place? What do we do in the case where it's inconsistent with some local priorities, but it is still genuinely a global priority? And likewise for when local priorities have been set, well, if those local priorities are also shared by others, right? So what I think, Mona, your group calls meta priorities, right? Well, how do we think about that, right? Should you have higher priority given to a local priority that's shared because the research information can be shared elsewhere? Or do we just think about the local priorities? So that's just to describe what the problem is. And I don't have a good answer to what we should be doing with it. I think we should not assume a blanket answer. That is, it's not true that setting global priorities, we should ignore local priorities. We've got to be sensitive to those. It's also not true that in setting local priorities, what the global priorities are should be ignored either. It always matters that the knowledge you're generating could be or could not be helpful to other contexts. Katherine, do you want to add something to that?
Yeah, and I really appreciated your answer, Joe. And I really appreciated the question, actually, because when I saw it when you were talking, I mulled it over. And I think actually the question is, in some senses, Joe, how does our guidance really address that question? And I wonder when I was thinking about that, I thought maybe that's actually one of the questions we need. And we've got a selection of questions that we should want people to be thinking about. Maybe that's not a bad one. But adding on to what you said, what got me thinking when I read that question, your AMR example is a fantastic example. So, right, you can imagine AMR the global priority for some research funders. And in the past, those research funders may have actually chosen to do the research in a setting where it was mostly feasible to do, but it wasn't a local priority, right? I think what the guidance is telling you is that you need to look, even if you're a global funder, at what is the social value of doing that research in that country to some extent. So I think it's that interconnectivity of the research. And when also, I think Joe was talking about if this is a big interest in a region, for example, so you look at something like malaria, and the relationship about the regional, even when you're making something at the national level in terms of research funding, you may want to look around and see what's happening in the regional level so you are not duplicating research funding efforts. So I think actually, whilst the guidance doesn't actually speak directly to the question by answering it directly, it does speak to it by asking someone who's operating at the global level and is going to fund in country to think about the social value of doing that research in the country, but also at the time that they're making the decision. And I think at WHO, we are thinking about this a lot, especially in the current climate, the relationship between the global, the regional, and the country level, and where the proportionality of the research needs to take place and where the resource needs to go. So I think there's clearly a relationship between those that Joe highlighted, and the guidance speaks to the really thinking about the value of doing something in a certain setting and whether that aligns with the priorities in terms of social value of that country. But I thought it was a fantastic question.
I think actually we could probably
Thank you.
develop a guidance jointly, because it's a both ethical issue but also an operational issue, as you said. So maybe a kind of appendix guidance of operational and the framework, how people can integrate that operationally. We could do it as a meta script potentially. Yeah. Sorry, Daniela, you go, please.
No. I very much agree. I think there is, I think from a day-to-day perspective, doing ethics on an institutional level, basically on a daily basis here, I think there's sometimes a bit of a confusion on how reality looks like and what is expected of the researchers, and a lot of researchers are just overwhelmed with how to implement things. And so, yeah, I would love to work on some real life hands-on examples and guidance for researchers.
And Daniela,
can
I quickly come back on that point? One of the things that really struck me in this process, we got a lot of pushback, and having a long time ago been on the other side of the fence and been a research funder, one of the things we always got is you're putting too much responsibility on researchers. We cannot do our day job and all these things. We got a lot of pushback for saying priority setting should also apply to researchers, and that they may not have power in their system, they may not have the capacity to do that. But I think the proportionality angle of this guidance is critically important in addressing that. And if there is anything we can do to support the research community in implementation of this guidance, so not to make it a burden when it's a consideration that should be done in your daily life, but we don't want to turn this into something that people perceive as a burden. So I think the proportionality question is actually critically important, and producing tools and ways of thinking that help people rather than add to what is probably already perceived as quite a burdensome existence anyway. I think it's really important.
I completely agree. I think because of the burden of governance and bureaucracy really, ethics is very, very often more of an afterthought than it actually guides our thinking, or it is even perceived as a threat. And so I think there is a lot to do in order to implement on the real life settings, these guidances and frameworks. I think that is something we can talk about the whole day. I just want to come back to the chat. There is another question in the chat. So there is an anonymous question. You have mentioned about the Delphi being a consensus building tool. So just out of interest, can the Delphi be used for priority setting, or is it just reserved for consensus building? I think that is a question for you, Joseph.
Yeah, thank you. And I moved very quickly at that point, so my apologies for doing so. Yes, Delphi method is often incorporated into priority setting processes in order to generate research options and also to compare research options on the basis of the criteria that that particular exercise is using. I was describing it as something that is involved in consensus building more as a contrast to other ways of comparing social value, right? So it's one of the things that you're doing in using the Delphi method is you're getting a group of people to feedback reasons to each other about why something is or isn't going to work, or why something is or shouldn't be high priority, and getting to consensus. But absolutely, that's part of doing priority setting.
So you have another question. So you have another question about how does guidance relate to questions relating to higher level priority setting decisions regarding resource allocation to healthcare versus health research? It's a big question. So.
It says here that Mona Nasser is going to answer this question live, so that's good news for us.
Oh, I just I put all of them as answering live that people know we are not typing. Sorry, but
yeah. So first of all, this guidance does not speak to the question of what proportion of an organization's resources should be allocated to health research, right? So it's not about how to grow the pot of money for health research. And it's not about which is more important, immediate benefits from healthcare or, future benefits from health research. And we very deliberately, that was excluded because it involved then biting off more than we'd be able to chew in this particular guidance. It is, however, of course, a really important question for some organizations, right? So organizations that are deciding should they put money into operations or into finding out more about what makes operations work better. And so, for example, in an emergency and disaster context, this is an issue. Organizations like MSF, who provide healthcare and also conduct health research, have to make this decision. And at at some level within any government, those decisions are getting made. And I think there are really interesting questions about fairness and justice that need to be answered in order to make them in a principled way. But it's outside the scope of this particular guidance. Would be happy to talk about it with anyone who is interested, because I think it's a really important question. It's just out of scope for us.
I know we're on 1 o'clock, but we have one question, if you could very quickly answer it. How do we ensure the ethics incorporated in priority setting where the process already started?
Yeah, that is also seems like a really important practical challenge, right? And the ideal is, like, one of the things we talked about a lot within the writing group, and one of the things we heard a lot in the feedback in different sessions, is how important it is to think about this from the preparatory stage, right? Who's going to be included? How are they going to be included? What are the principles that are going to guide the process? If you don't get that sorted at the beginning, it's not something that it's easy to tack on at the end. So as you might say, well, first of all, you shouldn't start from there, ideally. That said, I think there's always a gain to looking at the stage that you are in the priority setting process and thinking, okay, how now do those 4 ethical principles apply? And one of the things that is there in the guidance is, for each of the stages and each of the steps that can be part of one of those stages, it does lay out how the ethical principles can apply. So although the ideal is you start by thinking about the overall structure of your priority setting exercise, the overall process you're going to use in the light of ethical principles. If you find yourself stuck in a situation where you're partway through a priority setting exercise and now you're thinking, oh, I don't know if we've included ethics in the way that we should, you can say, let's look at what the steps are that remain, and let's look at the recommendations for incorporating those principles into the steps that remain. That's still perfectly possible.
And that did happen to us, Mona. During the course of this, we did have some groups that were halfway through priority setting exercises that realized during the course that they hadn't maybe addressed some of the underlying ethical issues, or they came up, some ethical issues came up in the process, which actually led them to knock on our door. So I would echo what Joe said. It's an imperfect model, but inclusion midway through the process is better than not including at all. But I think the answer to the question is there's a lot of work for us to do to show the relevance of this work and the value of this work. So there really has to be a focus, I think, on implementation and the implementation tools. And as Joe, I think, alluded to, we have a series of case studies and scenarios that will be published alongside that. And I think for a lot of people, ethics is really hard in the abstract, but the case studies really help people think through how this would apply to them. So yeah, I think there's a real onus on us to produce practical tools to show the value, but I would argue the non-perfect's still better than not doing it at all. So I would still encourage someone to come to me halfway through the process, and rather than say, oh, you should have come at the beginning, think, how can we work from here? And on that.
That sounds amazing. Thank you very much. And that's a very good place to end it. Thank you very much, Katherine, Joseph, for the very interesting presentation. And as you guys heard, it will be in April, the guidance will be out. And thank you for everybody for participating and asking questions. Thanks very much, everyone. Thank you.
Thanks.
Thanks. Bye-bye.